Good evening, good afternoon, and good morning, depending on where you are located. Thank you all so much for joining us for the second of ICRW's 45th anniversary webinar on reshaping the world of work for women. I am Firoza Mehrotra. I'm a member of the ICRW's Global Board and chair of the Asia Board. It is an honor to be with you all today, and I'm really very excited to be part of this webinar. As you know, we are celebrating the 45th anniversary of ICRW, and as part of this celebration, we are organizing a series of webinars. The theme of this series and of our 45th anniversary year is Discovering the Proof and Disrupting the Power. Quite a powerful statement. ICRW's proof fuels the long-term systemic change that drives gender justice all over the world, thus advancing the progress of women and girls and other people marginalized by their gender and other characteristics. Today's webinar on reshaping the world of work for women is situated in the context of COVID-19 pandemic, which has been excessively harsh on women and girls and their paid as well as unpaid work. Besides loss of incomes, women have also borne the extra care burden of looking after children who have not been able to go to school, as well as the elderly and the sick. The spike in gender-based violence has also taken a disproportionate toll on women and girls. So in this context, I would say that the webinar is really very opportune. Having said this, I would like to put a positive spin on the COVID pandemic. And since we all know that many countries were in the lockdown mode and families confined to the home, this gave men an opportunity to look at, appreciate, and recognize the amount of unpaid care work that women did at home. In fact, many men also started sharing in this care work, and I hope this will continue. Now I would like to hand over to Naomi Wandare from ICRW Africa to set the stage for today's webinar. Naomi is ICRW Africa's Senior Research and Evaluation Specialist, leading diverse national and regional intersectional research, evaluation, and MERL technical assistance. Over to you, Naomi. Thank you, everyone, and enjoy the webinar.
Thank you very much, Firoz, for the introduction. Good evening, good afternoon. We are pleased to have you here as we celebrate our 45th anniversary with this second webinar series that is specifically looking at women's work. As Firoza has briefly touched on, the COVID-19 pandemic has wreaked havoc for women, but not just for women. It has globally wrecked health systems beyond capacity, and the economic fallout has been far-reaching. Job losses, wage cuts, small businesses closing doors, and the added burden of social safety networks and government programs. Of course, many governments, Uganda, Kenya, India, and other countries, including the United States, came up with stimulus packages to help cushion the workforce and the women inclusive. However, today we also wanted to talk about what happens to the majority of the women. We know that in Africa and globally, the informal sector absorbs the majority of women workers. Most girls, young women, and adult women find their livelihoods within the informal sector. In just Uganda and Kenya and India, we find that the majority of women are indeed in the informal sector. In Uganda, 74% of the workforce in the informal sector is comprised of women. In Kenya and India, the trend is the same. However, we did find that the COVID-19 response actions did not adequately take into account the needs and the special circumstances of women workers in the informal sector. Organizations like ICRW, in partnership with other civil society organizations like Oxfam, which is present today, and ActionAid, have partnered to look at ways that we can generate evidence to contribute to the discussion about how the future of women's work could look alike. So a range of researches have been implemented, and these are coupled with implemented programs in the past where we would like to draw lessons that could help us contextualize our discussions as we think about what the situation could look alike for women workers as we repackage and reimagine their future post-COVID. So today we'll hear from our colleagues from India who have implemented programs in the past, around women working in non-traditional sectors, as well as, encouraging streamlining of employment and skills building programs to enhance the girls' capacity building and empowerment for them to be able to aspire for greater things. From Africa, we'll be hearing from our colleagues, Chirabo and Crispin, what is happening in the area of manufacturing, touching on the study that was done in Kenya around women in manufacturing and sharing results around that, and hopefully generating discussions around how we can pick lessons that will help this community shape the future of work for women. We've also done a project called Rebuild, which is mainly looking at the COVID policy impact on women workers in the informal sector. But we are really applying an intersectional lens, as is known for by ICRW, that we don't only look at a woman singularly, we look at her holistically, at the intersectional barriers that she faces because of the gender that she is. And therefore, this policy research project that Chirabo will talk about will share some findings, early findings that we can talk about and come up with further recommendations on what the future of women and girls could look like in the workplace. So without wasting much time, I would welcome you to listen and to share your questions in the chats, to share your comments as well when the speakers talk. We'll also have panelists share their ideas and opinions around what the landscape for work around women's economic empowerment looks like and what's possible at policy level. I'll hand over now to Emily. Emily will introduce our next speakers and presenters from our Asia team. Thank you very much.
Thank you, Naomi. And I also won't waste too much time. So let me introduce Sharmish Sananda and Nilanjana Sengupta, who are both technical specialists in our ICRW Asia office.
Thank you, Naomi and Emily, for kickstarting the session and for the great introduction. Before diving in, can we have the next slide, please? Thanks. Before diving into the presentation that we have, I want to take a moment and a step back and talk a little bit about the fact that in the context of India, especially, a lot of work, specifically since around the 1970s, focused on the barriers for women to enter paid work, to foray outside the domain of the household, and raised critical questions on the burden of unpaid care work that women have to shoulder, and how intricately that's linked to the gender norms that have persisted in our context for centuries, how that means that there is an expectation for women to prioritize care work within the household versus paid work, unpaid care work within the household versus paid work that requires them to venture out into the world. And this in turn has meant that intergenerationally women have had lesser time and lesser access to education, skilling, and other resources that are needed to be able to enter and sustain in paid work, such as reliable transport or safety in the workspace. And all of these things, as we know today, have been exacerbated in the context of COVID. But it's not as if we were not aware of these barriers. It's not as if we didn't know how, in contexts such as India, the complexity of these barriers multiplies manyfold. When we look at degrees of marginalization that are borne by discrimination based on caste, on socioeconomic class, on where people are located, the geographical location, and in recent years also issues such as access to digital media and digital platforms for accessing information as well as opportunities. Some of our recent work focused on understanding what could be some alternative pathways to circumvent some of these barriers that we have been gathering evidence on for a long time now. And specifically two things that Naomi also referred to in her introduction that we thought are very relevant even in the current context is a gender integrated life skilling and employability programming for young adults and adolescents, and B, a non-traditional livelihoods approach to fast tracking women's entry into the labor force, not just in sectors where women have traditionally been present, but also finding pathways for enabling women to enter sectors and occupations where their participation has been traditionally and normatively very limited. But as we were coming up with this set of evidence, the COVID-19 pandemic struck, and the world as we knew it, and all of the innovative strategies and programming that we have been collecting evidence on changed drastically. Gains that were made with decades of effort on women's empowerment, women's workforce participation, have now been reversed in many ways. And in the context of India, as is true in many other contexts as well, women's participation in the workforce has been substantially declining since the early months of early months of 2020. Sorry. Can we have the next slide, please? So I'll link back to the Rebuild project that Naomi introduced and talk a little bit about what we are seeing in this ongoing project, where we are collecting a range of evidences using various methodologies in India, Kenya, and Uganda, focused on women in urban informal economies. But before venturing further into what we are learning, I think it's important to highlight that we need to reframe this discussion and this narrative of women in the informal economy by first understanding who are these women and what does the urban informal economy look like. As is known for a while now, urban informality in itself is a very complex and layered phenomena. And those who end up working in the informal economy also largely occupy an informal space in the city. They are often at the margins, and they have a very ramshackle, non-existent relationship with the state. And while examining what happened in the context of COVID to this group of women, it's important to have this context in mind that there was a pre-existing void in terms of policy attention to urban informality, to infrastructural support to for migrants, especially considering that rural to urban migration is a very key feature of developing economies like India, Kenya, and Uganda at this point. And even during the COVID-19, as it unfolded, the pandemic, we saw that immediate policy responses operated within that pre-existing void, which means that a lot of attention remained, not just in the time when things were just starting out, but continued to remain on clinical management, quarantine, mobility restriction, and lockdowns, with very low focus on social protection or cash payments or transfers, in a way that these measures can reach the people for whom they were intended. So it would not be an exaggeration to say that build back policies in that way were not very strong, but there was an immediate response to the pandemic just as a health crisis. But we know now that the pandemic is not just a health crisis, it is a larger humanitarian, socio-economic crisis. So to understand how the pandemic is shaping experiences for women in the informal economy, we are now learning that our approach to research and programming and evidence generation needs to be much more intersectional, needs to be much more dynamic. It needs to connect the state with the markets and the households. It needs to understand how gender norms operate within these three institutional structures. And it then also needs to examine the policy void, why it exists in the way that it does exist at this point. I'll stop here now, and I'll hand it over to my colleague Nilanjana, who will talk about how the pandemic was experienced by rural women's collectives in India. Thank you.
Thank you, Sharmishta. We saw some of the critical challenges and vulnerabilities arising as part of our urban informality and the need perhaps for a multi-dimensional gendered approach. I will bring reflections of how rural women's collectives in India coped with the humanitarian crisis by adopting a multi-pronged gender-sensitive approach. For this, I'll be referring to our ongoing research with a gender mainstreaming program called Gender Justice Program, which is being implemented in Madhya Pradesh in India by one of our CSO partners, Anandi. The objective of the program is to engender microfinance-based rural women's collectives by building a strong cadre of women community leaders and linking the members of the collectives to government schemes and programs, as well as other entitlements and rights. Now, during COVID-19, these community leaders realized that they had to build a certain kind of resilience to combat not only the health crisis, but also the social and economic crisis manifest through loss of income, loss of employment, food insecurity, and communal disharmony, such as the targeting of Muslim community as vectors of disease in India. They were also cognizant of the gendered nature of lack of access to resources and entitlements and sought to build coping mechanisms for rural women from marginalized communities. Next slide, please. Yeah, next slide. Yeah, thank you. To this end, these community leaders, through their rural women's collectives, undertook various activities. First, they worked very closely with the local administration and spread awareness about the disease prevention and care. This they did telephonically during lockdown. And you know that India saw a major national level lockdown during the early period of the pandemic. And later, when things opened up, they actually went door to door, attended public meetings, and spread awareness about the pandemic and its prevention measures. They also supported local administrators to convert village community halls into quarantine centers and did a door-to-door survey to identify patients, quarantine them, and provide healthcare to them. Later, when the vaccination drive started, they organized local vaccination camps, spread awareness about the need for vaccination, and mobilized women and men to come to these camps. In this way, they worked closely with the local health institutions. As many of you know, India faced a major crisis when millions of migrant workers returned from cities to villages, sometimes by foot. These community leaders also arranged transport for many of these migrant workers who were coming back from the cities to their villages. They would collect information about who was stranded in which city and work with local authorities to provide transport and other facilities. Once the migrants returned, they helped to screen and quarantine them and provide them with food and relief. Several families were also facing major income loss during this period. The community leaders helped to connect women from these families to existing employment guarantee schemes, which assured a few days of employment and thereby wages. Further, in a situation where existing women's businesses were suffering losses, they supported local administration in organizing training for women to make masks, sanitizers, and soaps. Not only training, they oversaw the production and sale of these items through the collectives themselves. A large part of these items were bought by the government and some were sold in open markets. This too provided the much needed income to families. In the event of income loss and food insecurity, two critical schemes of the government were direct cash transfer and distribution of food rations. The community leaders not only spread information about this, but were also proactive to facilitate the critical links to access. This meant filling gaps in documentation required for access, such as helping women get the food ration cards or being vigilant about corrupt practices that restricted access. For example, in a particular village, when some women complained that despite applying, they had received less than the promised amount of cash benefit from a local governance unit, the community leaders went to negotiate with the local officers and threatened to escalate the case to higher levels of administration, which immediately bore fruit, and the full amount of the cash benefit was transferred to women's bank accounts. There were also misgivings and misinformation among the community about COVID-19, with specific biases against a specific community, that is the Muslim community, who were seen as vectors of disease. The community leaders dispelled these misgivings by giving scientific information about the disease and calling for a solidarity among all the people in the village. They met with women from the Muslim community and assured them of their support in all situations. These collectives and their leaders also took cognizance of rising domestic violence cases and created support for survivors by connecting them to medical and legal aid, giving a show of support to the survivor in front of her family, and counseling the survivor and her family in order to reduce conflict and create a safe space for women. These were some insights from India about the way COVID-19 impacted women workers and deepened vulnerabilities, and also how in some cases, women's community-based collectives worked with local administration to devise strategies to cope with these vulnerabilities. I now hand over the mic to my colleagues in Uganda and Kenya, Crispin Afifu, who is a gender and women's economic empowerment specialist, and Chirabo Subi, a gender economist. And they will be talking about their experiences of the challenges brought about by COVID-19 and the response to it by governments and communities. Thank you very much. Over to you.
Thank you so much. Good evening, good morning, wherever you are. First of all, I want also to welcome you to this presentation and discussion. And for now, from Africa, I want to start it this way. as ICRW, today we invite you to celebrate our 45th anniversary. And so the first question you might be wondering or asking yourself is, what are we celebrating? We are actually celebrating 4.5, that is 4.5 decades of evidence that has been generated and translated and packaged in different ways across different parts of this world or in the various continents, so that then that has been utilized by governments, by the private sector, by other institutions. And this, we do not attribute it only to ourselves, but also to our partners, including government and private sector and collaborative partners elsewhere that have also done their bit, their work, because the work that has to be done cannot be done by one organization. And so we call you to celebrate together with us as we look at various interesting issues and areas that ICRW Africa and of course globally has been attending to. Now, on our part, we will narrow into what, in this case, women's economic empowerment. And why this is important at such a time as this is that over the 4.5 decades that we have been working as an organization, we've also realized that for the full realization of the equality of rights of women and men and boys and girls in societies across, there is an issue that has to be addressed, that of economic empowerment, because by critically addressing economic empowerment, which is a process of achieving equal access and control of economic resources, then we will be curing one of the challenges that has dragged us for far along a time. Also, when we look at the world of work for women, you and I know the majority of women across, they have been engaged largely in caring, in catering, in cleaning, in clerical functions, in cashiering, and across a spectrum of services. And so when we look at those services or those functions that they've been undertaking and where we are and what the world of today demands, is it enough? And so we are here to discuss more about even how to generate better evidence to be able to establish reasons, or not just reasons, but creative ways as to how we can recover together and build back better. Kindly move to the next slide. Now, on this slide, you could move to the next. So on this slide, we have been talking about women economic empowerment. And so as we know, almost all countries are actually signatories to the Sustainable Development Goals. That is goal number 5, which espouses that for sure women and anyone else, we need to achieve what we call the economic empowerment to its optimum. And so as an organization, we've come to establish that there are various sectors where women are involved, and there are others where they're included, yes, but the percentage to which they're included and the level of participation has either enabled them to advance or stagnate, or they are into oblivion. And so one of the key sectors that we are picking here today is the sector of manufacturing. And this is based on one of the first ever formative study that we did in Kenya last year through early this 2019, 2020. It was, we call it Women in Manufacturing Study, which the ICRW did together with the Kenya Association of Manufacturers. And it was the first study to be able to establish the role of women in manufacturing, where they are in terms of leadership. And of course, what are the barriers that they are facing, and what can be done for them to optimally participate in this non-traditional sector, which of course is actually a pillar to the growth of the economy of this country and other countries across. And so just a snapshot of that, you realize from the figure that you're seeing on your screen is in the year 2018, you see that about 84% of the workforce, this is about 144,000 of the workforce in manufacturing were actually men, against 16,000, which were, 16% of which we see were women. And even the year after, that was 2019, you could all see an increment of 1% on the part of women. And this 1% actually is largely at the factory floor. And so we are looking at them doing a lot of manual work. And so, or at least what we can call casual labor. But by and large, when we were looking at the entire spectrum and the organizations, or the organization of these companies, you realize that at the very top level, at the C-suite level, they are very few. And so at least at the middle, they are at the managerial level, there is a fairly good number, but majority are at the ground floor, whereby factory floor, whereby they are not necessarily involved even in decision making. And so if you miss in decision making, you are not likely to influence anything in that direction. And so it was an eye-opener for us to be able to establish that if they are there, how then are they going to grow in this sector, which is a pillar to the economy? Next slide, please. On this slide, it presents the picture. It's a mix of formal and informal. And to speaking on the part of the informal, we realized that women in Kenya, 93% of the informal businesses, and I saw a question about informal businesses, which we're coming to answer, is that they are the owners of these businesses. These are businesses, most of them are unregistered by anybody. And so women are the majority owners and majority workers. And so is, when we pick at manufacturing, we also see that we're talking about 61,000 women, at least as of 2019. So when you look at the discrepancies in the number and where women are and where they're missing, then it will tell you why we have to focus more into attending to the issues that make them, or the barriers that are actually preventing them to break the glass ceiling and be able to establish where the leakage is in this pipeline and be able to seal it through evidence. Next slide, please. Now, this slide presents the challenges and of course, and the opportunities, which you're going to see in a minute. So in the side of challenges, we realized from the study, we're able to establish that a majority or the number of challenges that women are faced, they are challenges that are legal in nature in terms of the legislative framework that is gender blind and gender neutral. They are also cultural in nature in terms of even how the socialization and of course the bringing up of girls and the girl child and lack of the necessary training to be able to enable them to engage further in this non-traditional sector. And when we look at all those, yes, they are there and it's common knowledge, but then what are the solutions? Some of the solutions that we realized that we could, that we have proposed is that number one, we're looking at strengthening, next slide please, strengthening the multi-sectoral stakeholder advocacy engagement so that then this work that brings together the private sector, brings together government, brings together development partners, brings together the women themselves as an agency of their own, looking at a woman as my colleague said earlier, as a whole being, so that then we're able to look at issues not from a point of gender blindness, but in terms of gender responsiveness to attend to the issues or to the barriers that we have seen are clustered in different levels. At the very, at the middle level, we're looking at the opportunities that exist. And then of course, these opportunities is aspects of mentorship, networking and training programs. And then this training in Kenya, for instance, there are a number of institutions, including the technical vocational training institutions that comes in to bridge the skills gap. And it will interest you then to know that a part of this celebration is that RCRW have been able to share with policymakers on how to skill and reskill and upskill to be able to bridge that gender gap. So in the manufacturing workforce, which if we do, and there is consistent follow-up and accountability, then we'll be able to see increment in numbers of women in terms of entry, in terms of being retained and even promoted within the manufacturing value chains across. Now, as we, next slide, please. Now, before we move to this slide, I would want to say that that study that I've just talked about has been, there are knowledge products that have been, of course, been published. The full report, which I see has been already, the link has been shared on the chat box. We have 2 policy briefs that have also been disseminated through webinars as early as June and July this year, involving the policymakers in government and of course influencers outside of government, that is the private sector. And we hope that this could be followed up until we see something happening in terms of a real policy change within the government level and opening up spaces for manufacturing. We have had opinion pieces published in the daily newspapers, and we've also had our partner, that was the Kenya Association of Manufacturing, also being out there to launch the program, that's the Women Manufacturing Program, and extend it everywhere so that then many are attracted to be onboarded. So at this point, I hand it over to my colleague, Chirabo, to start off with the rebuild.
Thank you, Crispin. As Crispin has said, my name is Chirabo Subi, and I'll start off with the rebuild project. So ICRW is currently implementing a multi-country project dubbed the Rebuild Project. The project aims to assess the impact of the pandemic and what it has had on the informal women workers in the countries of Uganda, Kenya, and India. As you have heard from the previous presenters, women predominantly earn a livelihood from the informal economy. In Africa alone, the informal economy employs 90% of the women. This is really substantially high. From the data that we have reviewed, we've seen that 15 million Kenyans are employed in the informal economy, and this accounts for 86% of them who are women. In Uganda, 13.7 million Ugandans are employed in this informal sector, and women account for 87% of workers in this particular sector. So we see that women predominantly earn a living in this sector. However, COVID-19 pandemic has had unprecedented impact on the economies, especially the informal economy. Women in the informal economy are at a heightened risk of being vulnerable in the areas they work due to the insecure working environments that they are in, the discriminatory policies that are in the informal economy, and there is limited access to grievances and redress mechanisms. In Uganda alone, 61% of women-led small businesses have failed to generate income compared to 22% of men-led businesses due to the COVID-19 pandemic. Next slide, please. In the wake of COVID-19, many governments across the world announced a raft of measures to bolster social protection. And this was meant to cushion the populations, including the vulnerable, the poor, from the socio-economic impact of COVID-19. We saw governments putting together food rations for the populations. They put in place unrestricted movements for essential workers, and also those particular individuals that were involved in food-related services. We have seen measures to do with cash transfers to the vulnerable groups. There were tax exemptions. There were basically monetary and fiscal policies put in place by governments to support the populations. Tax exemptions on mobile money transfers. This was done in both Kenya and Uganda. We saw tax relief measures across the world as a means of relieving the effects of the pandemic, insurance protections for those who are in employment, and of course, a reduction in payments on pay as you earn for employees who were supposed to remit the pay as you earn for their employees. However, we have seen that informal workers have not been sufficiently reached For example, in Uganda, we had the COVID-19 relief fund, but we have seen that this is under probe by the Parliamentary Accounts Committee due to the irregularities in its implementation. Next slide, please. Next slide. Amongst the social protection measures that have been put in place by different governments and the social protection policies that we have, there are existing gaps. For example, the inadequate targeting of informal women workers and informal workers at large. These ones there is not enough social assistance amounts for them in place. We do not have policies to do with social protection regarding coverage for these informal workers, and there are no policies to do with the duration of how long this particular group should be covered with the social protection measures. There is also absence of guidelines to facilitate direct income to support informal sector workers. So this has really created challenges in implementing these policies. There is also a biggest challenge of inadequate financial resources for social protection. And next slide. One of the emerging themes in our research that we have been doing under the Rebuild project is the unpaid care work. We know that care work is the hidden engine that keeps the wheels of our economies, our businesses, our societies turning. But given the prevailing gendered norms, it is heavily shouldered by women. For example, women spend 3 times more hours than men in unpaid care work, and this is due to the existing gender norms, like I've mentioned. COVID-19 pandemic has, however, increased the burden of unpaid care and domestic work, and the highest proportion is being carried out by women. Women spend more time on unpaid care work, and this hinders them to spend more time on paid care work. The fact that majority of the schools across the world, UNICEF mentioned that 1.5 billion children have been estimated to have been affected by school shutdowns during the pandemic. Majority of the care of taking of children, looking after them, looking after families, was mainly shouldered by women. Next slide, please. Women in the informal employment have a number of asks to the policymakers. We need to see that the policies, amongst the policies formulated and adopted, there is an integrating of gendered lens to these policies and emergency responses during crisis. This also includes adopting policies that are around care, for them to be adopted, budgeted for and implemented to support women, especially the most disadvantaged ones who are in the informal sector. We need to see the strengthening of partnerships between government, private sector, and civil society organizations. For example, in Uganda this morning, we had a discussion with members of parliament regarding the women economic agenda at the national level. So we are trying to see how we can work together. For example, private sector can come together to work with government and CSOs to finance different business models for the informal sector. Also, CSOs could support together with government to set up childcare facilities in workplaces where women are, and they should be reachable by people in the informal sector. We also need to look at designing of social protection products beyond the cash transfers for the informal sector. This could include designing social and health insurance packages, because currently individuals in the informal sector are excluded from these services. We need to intensify capacity building efforts This will help in managing risks and debt management, and also making sure that there is resilience for businesses that are managed by individuals in the informal sector, especially the women, because we've seen the impact of the pandemic that has had on their businesses. Thank you so much. At this time, I'm going to hand over to Emily.
Thanks so much, Chirabo and all of our speakers this morning. I'd now like to turn it over to a panel discussion, which will bring in some of these key points that we've just heard. So let me ask each of our panelists this morning to turn their cameras on. I'm delighted to introduce them. Amber Parks is a senior advisor on women's economic empowerment and care with Oxfam Great Britain. Her work focuses on the intersections of care and inequality, linking national and global policy advocacy. Anam Parvaz-Bhoot is a gender justice research lead and policy advisor in the evidence team, also at Oxfam Great Britain. Her research primarily includes social norms, women's economic empowerment and care, and ending violence against women. Robin Runge is the co-director for equality and inclusion at the Solidarity Center. She provides strategic programmatic technical leadership and technical assistance to the Solidarity Center staff, partners, and allies internationally, and oversees implementation of the Solidarity Center's global campaign to end gender-based violence at work. And finally, Rita Hope Axiero-Lacour is the executive director of the Uganda Women's Network. She has worked on issues related to girls and women in politics, leadership and decision-making, as well as land and economic rights, peace building, access to justice, and sexual and reproductive health and rights. So I'm going to start off here with a few of my own questions, but I'll invite the audience to continue submitting your questions to the Q&A chat in Zoom. I'll make sure to keep some time at the end for audience questions. Let me start with you, Anam. What has COVID taught us about the limitations for women of our current framing about work and the economy?
Thanks, Emily, and thank you, ICRW colleagues, for inviting us to be a part of this exciting and informative event. On your question, Emily, I think one thing COVID has really shown us is how the existing sort of dominant narratives about work and the economy often exclude or trivialize informal and unpaid work that, as we know, is predominantly done by women. And so this includes narratives like, the economy is shutting down, whilst we know that unpaid care and some forms of informal work were operating in hyperdrive. Chirabo was mentioning, earlier how overstretched, care systems, closures of schools and services has further shifted care responsibilities from the government to families and within families onto women. And elsewhere, we've heard how domestic workers have been told to work overtime with no increase in pay. Along with this sort of narrative, there are also narratives that, women informal workers' income is just extra money or pin money because they have somebody to support them. Yet again, what COVID has shown us is how critical this income is for families and how these jobs deserve equal rights and wages. And a related narrative is that, unpaid and informal work is less skilled. It's less valuable to the economy than other forms of paid work. And again, we've seen just how essential it is to our economy, our health and survival. And there have been these growing demands from the public to governments to recognize care workers as essential workers. And then this is, I think, lastly, a framing which I've heard a lot, even within our own development circles, and it's around, creating economic opportunities and jobs that have been lost during the pandemic, supporting women to enter the labor force. Yes, but also, supporting the rights of women who are already working, and that includes unpaid carers and informal workers. And I think that these narratives, and I also feel like what they're doing is that they're creating these false or unhelpful dichotomies between valuable, unvaluable, formal, informal, skilled, unskilled. And these sorts of narratives and dichotomies have real implications influencing, which types of workers get prioritized in COVID response and recovery packages, shaping important policy and investment decisions. It's been talked about how, informal and unpaid workers have been overlooked by response measures, which have actually prioritized workers who are employees with formal contracts and permanent jobs. And I was reading a few weeks ago a statistic that was produced from some analysis done by the UNDP based on their gender response tracker that's revealed how less than 6% of national government measures in response to COVID have actually addressed unpaid care. So yeah, just these are some of the narratives that I've come across that I think it's important to take stock of and shift. Thank you.
Thank you. And I wonder if I could ask you to speak a little bit more specifically about Oxfam's research on COVID and unpaid care during this time.
Sure. So together with partners in May 2020, so toward the start of the pandemic, Oxfam undertook research in 5 countries, which included the US, the UK, Canada, and then zooming in on poor urban communities in the Philippines and the informal settlements of Nairobi, Kenya. And beyond understanding, how COVID has affected women and men's unpaid care workloads, we also wanted to understand the impact that changes in time spent on care work has had on their health, their economic security and well-being, and also to better understand the intersectional impacts, which are often overlooked. And we found that women, particularly those living in poverty, single mothers, essential workers, as well as families belonging to minority racial and ethnic groups, were doing the bulk of care work during the pandemic. So as an example, in the Philippines, internally displaced people, single mothers, those enrolled in the government social protection program, reported on average an increase of more than 5 hours in unpaid care work a day during the pandemic. In low-income contexts where basic infrastructure is lacking, women reported that the kinds of care activities that were the most time-consuming were related to domestic work, so water collection, washing, cleaning, disinfecting. And then, of course, this has long-term consequences for women's health, their economic security and well-being. So 43%, so nearly half of the women we surveyed across all 5 countries, reported feeling more anxious, isolated, physically ill because of their increased care responsibilities. And that's not to say that men weren't spending more time on care activities, but that this was far from being equally shared. And so that signals that a shift in gendered norms is also necessary. And in terms of what we use the findings for, we use them to inform a global campaign called #HowICare to shift gendered norms together with Promundo and partners. And then it also helped inform our flagship Women's Economic Empowerment and Care Program, which has been working in 25 countries since 2013 to address heavy and unequal unpaid care work. I saw that there was a question that came up in the Q&A, so I would encourage you to look at that as an example. And just lastly, before I finish, I think the research, along with other research we've done, has really highlighted the need for an integrated care system. Going beyond a particular policy or service, such as childcare services, which are getting a lot of donor attention, to look at the kind of suite or array of care-related policies that are needed to be, to put in place, such as basic infrastructure, like pipe water and electricity, social protection programs, and how these services need to also then go hand in hand with efforts to shift social norms. So we found that without continuous work on social norms, new water systems, for instance, can actually lead to women spending more time on care because of these sort of norms around how it is their responsibility, and because there's more, water available, and it's easier, they should be washing clothes more often. So yeah, I'll stop there. Thank you.
Thank you. So sticking with this thread of unpaid care work, Amber, I believe just yesterday you hosted an event on the new care policy scorecard. I wonder if you could tell us a little bit more about that.
Sure. Thanks, Emily. And just echoing Anam to say thank you so much, ICRW, for hosting this really timely discussion and inviting us on the panel today. So our thinking for the idea behind the care policy scorecard really began back in late 2018 when country teams and partners working on care policy advocacy really identified the need for a tool that outlined what an enabling policy environment on care actually looks like, and sort of to serve as a roadmap, I guess, to help inform what policy advocacy they should be focusing on. And we knew that while there was a growing body of literature on which care policy measures are important for addressing care work, to date, there was no global instrument that really synthesizes information and provided a practical tool to track and measure progress against key policy areas across different contexts. And I think this really reflects a general lack of data to measure progress on gender justice more broadly. And it was a recent UN Women survey, I think, that showed that out of 69 countries and areas, only 19% have a system to track gender budget data and make them publicly available. So the scorecard is really trying to also address some of these broader gaps. It was really through a collaborative and co-creation process with several national, regional, and global organizations and partners, including, of course, ICRW and the Ugandan Women's Network, where we developed this care policy scorecard, which we launched together yesterday, as you mentioned. And this really also builds on the work of previous feminist economists and the ILO and others as well. So we're really not trying to reinvent the wheel, but developing, I guess, a practical tool that builds on existing frameworks. And the scorecard really aims to help civil society and governments alike to begin engaging in a conversation that's identifying what gaps exist and enhancing the existing care policy frameworks, while also, I think, really importantly, trying to transform some of these hierarchies that are hidden within the care economy that we've heard about today, such as gender inequality, informality, and others. So the main sort of part of the scorecard is, if you like, is a set of policy indicators and questions to help assess progress systematically and holistically across different public policy areas, particularly when it comes to policy adoption, but not just whether the policy exists, but the budgeting behind it, as well as how it was actually designed and implemented and how transformative that is in terms of who was involved in that policy making in the first place. And we've really, as well as making sure that this is comprehensive and evidence-based, our focus is on making sure it's a practical tool that can be used in different contexts where data may not exist. And I guess I speak for all organizations involved in developing the scorecard with us in saying that our hope really is that this tool can practically inform and enable ongoing advocacy efforts around the care economy that have existed, of course, for many years, but have also really ramped up during COVID, as we've all heard and know very well, and which are now more important than ever. Thank you.
Thank you, Amber. Let me turn to you, Robin. You've previously spoken about the role of unions in increasing women's equality and equity in the workplace. I wonder if you could expand a little bit on what that looks like now and what it looked like before COVID and the sort of challenges faced in that space.
Sure. Thank you so much for having me. So as a global workers' rights organization with working to support worker organizing in the Global South in over 60 countries, the last year and a half, as we've heard described by other speakers already today, has been devastating. The vast majority of the workers that we support work in the global supply chain, in the ready-made garment sector. A lot of those jobs are permanently gone. Many of the workers we support are domestic workers. A lot of those jobs are permanently gone. So we've seen some dramatic shifts in the economy for the global low-wage workforce. We also recognize that the majority of the workers that we support have no access to vaccines or testing. So the impact of COVID has been incredibly dramatic in the loss and the trauma experienced by women workers in all the different ways that we've heard, including their increase of responsibilities for caregiving, but just incredible ongoing day-to-day trauma. Contributing to that, which is not surprising, is an incredible increase of instability, economic instability, as well as social and cultural instability, state government instability, and all of that exacerbates intersectional identity inequality that women workers really feel the brunt of. And we've seen a lot of this very well documented. And so the need for collective power, the ability to bring workers together and have solidarity, to collectively push back on these pressures, to participate in national and local advocacy, whether it be shifting policies to expand social protections for women workers in the sectors that I've just identified, fighting for wage replacement, making sure that social protections actually do meet the needs of women workers, which actually is different, and meets the needs of women workers with disabilities, which is also different, and meets the needs of migrant women workers, which is also different. And so our unions around the globe have been engaged in that. One thing that I want to focus on that has been ongoing focus for the organization for several years, and for the global labor movement that has heightened in the last year and a half, is ending gender-based violence and harassment in the world of work. Our global women union leaders a decade ago identified that a primary, if not the primary, barrier to achieving equality in the world of work for all workers, but especially low income and low wage workers in the global South, was gender-based violence and harassment in the world of work. And let me be very clear, often when we talk about gender-based violence and harassment, and most of the data collected, and I come from the domestic and sexual violence movement, so I've watched this over the last 3 decades, is actually talking about domestic violence in the home or in the community or in schools. We actually don't talk about gender-based violence and harassment in the world of work. We call it sexual harassment, and we're not really sure what we're talking about. You know, the Me Too movement has really made it clear that we're all walking around with very different understandings of what that is. And as women who predominantly experience these abuses, we've been taught not to talk about it. And that silence diminishes our power. And again, we saw through Me Too, when people disclose and have spaces that are safe to talk about their experiences, we actually do build solidarity because we see similarities. We also see the scope and the epidemic nature of this. And that's the work that these women unionists wanted to do when they came together about 10 years ago and said, look, we're all experiencing this at work, let's be very clear. And we need tools to address this in the world of work. And they decided to launch a global campaign to end gender-based violence and harassment in the world of work that included specifically getting the International Labor Organization to adopt a global binding legal standard to specifically establish a right to be free from gender-based violence and harassment in the world of work. And after many years of incredible advocacy and organizing that included gathering data and experiences of women workers and low-income women workers in particular. In June of 2019, the ILO did adopt the first ever global labor standard to eliminate violence and harassment in the world of work. And this is, I call it a feminist labor standard, and I'm going to explain why. And during the pandemic, our women leaders in their unions have been working toward implementation and ratification of this convention because it provides a tool for change that governments, employers, and unions together, and that's really important. The International Labor Organization is the only place in the world where governments, employers, and workers' rights organizations collectively designed and negotiated this labor tool. The majority of employers and the vast majority of governments, in addition to all workers' rights organizations, voted in support of this convention, and including the United States. And that's not insignificant. And so what we've seen during this pandemic is our sisters in Nigeria, in Cambodia, in Honduras, and elsewhere, continuing to push for ratification by their countries of this convention, but also in their workplaces, coming together virtually, right, often, and sometimes outside, depending upon where they are, and continuing to build power through sharing their experiences with gender-based violence and harassment in the world of work, and defining for themselves what that looks like for them in their workplace. It does not surprise any of our listeners to know that what gender-based violence and harassment looks like for me sitting here in Washington, DC, in my home, which by the way is my workplace, is very different than a worker in a garment factory in Cambodia. And that is very different than an agricultural worker in Morocco. And that is very different than a mine worker in Botswana. And that is very different than a banana worker in Honduras. And as a result, we can't have a one-size-fits-all approach, right? And what we know is that approaches that are led by the workers who disproportionately experiencing these abuses is the most effective approach, because not only do they define what it looks like for them. So for example, when they designed questions to interview their coworkers and raise awareness about this, one of the questions a garment worker in Cambodia came up with was, does your sewing machine mechanic ever ask you to be his second wife in order to agree to repair your sewing machine? Now, I would never have come up with that question, y'all, but that's why it's not appropriate for me to do so, right? At the Solidarity Center, what we're doing is creating the spaces where those women learn those skills, design the questionnaires, conduct the interviews, create the report, and advocate with that information to make the invisible visible. And then design through collective bargaining agreements, workplace policies, and legislation, interventions that are directed at the root causes of those abuses. And really at changing the culture in those workplaces, because through that research in those countries, in Nigeria, over 50% of the women through a participatory research process that we're just concluding, these women interviewed over 1,000 women in different sectors, including the informal economy in Nigeria, and found that over 50% of them are experiencing different forms of gender-based violence and harassment as they defined it. The numbers in Cambodia and Indonesia were as high as 75 and 85%. And now they're taking that information and designing interventions. And the other thing is, when you ask the women experiencing this, what do they want to see change? How do they think they can be safer? The outside world thinks, well, they want to have them fired, right? Actually, no. Actually, no. The vast majority of the workers that we speak with, they recognize that firing that person who did that actually places them at higher risk. We've had women physically and sexually assaulted more by the person after they get fired or their family members in the street or in the community. That's the first problem with that. So you have to have an approach that engages that individual and asks them what is their safety needs. But the other reason it doesn't work, and they tell us this and they use this language, is because the employer is just going to hire somebody else with that same power, another guy who's going to do the same thing. They call it a pop-up doll. So what they recognize is there has to be structural change to how work is organized in order for those abuses to stop, because it's about power. It's not about sex. It's about power. And so we have to shift power through worker organizing. And that's what we're starting to see, is workers coming together and communicating with employers about, even during COVID, right? Even during, especially, I would argue to you, especially. And I think related to that too, are workers, as some of them are at home doing work more and more, and we've always had at-home workers in the garment sector, for example, is recognizing that that is home. C190 not only defines gender-based violence and harassment in the world of work for the first time, it has to apply to the world of work. So not just the physical space where work is done, it's in restrooms, it's the commute, it's your home, it's anywhere. And that change has to happen in legislation, that the world of work is free from gender-based violence and harassment. And employers and governments and unions all have responsibility for that. Similarly, hearkening to some of the themes of my colleagues here, it applies to all workers, not just full-time employees with contracts, because the majority of those workers are men. They're not marginalized workers. They're not women. They're not informal workers. The term worker is defined to include public and private sector workers, workers without a contract or with a contract, workers who are paid or not paid, right? So that's really important. And so these are shifts that our unions and our partners in the field and the women that we support are pushing for legislative, like I said, and changes in the collective bargaining agreement that have these expansive definitions of gender-based violence and harassment, this expansive coverage of all workers and the world of work, which is really critical to seeing these workers as workers, informal workers, for example. So I think I've gone over my time, but those are just some of the examples of the work we're doing and that I'm privileged to be a part of.
Thank you so much, Robin. Really interesting and a huge amount of information there. I see lots of appreciation for what you've talked about in the chat there. So let me bring in Rita before we turn over to some audience questions. Rita, from your perspective, what are some ways in which pre-existing laws and policies have exacerbated existing gender inequalities, such as the burden of care work, gender-based violence, and especially informal workers during the COVID pandemic? Rita, I think you're on mute.
Sorry about that. Thank you so much. Good afternoon, everyone, and greetings from Uganda. The question that I was given was to answer what some of the pre-existing laws could have exacerbated the conditions of women, particularly those in the informal sector. I must first of all start by saying that as a country, we are one of those countries, not just on the African continent, but I can say confidently in the world that has quite a number of progressive laws that protect the rights of women vis-a-vis the rights of men. The Ugandan Constitution of 1995 provides for equality between men and women in all spheres of life, in the social, economic, and political spheres. And of course, the Constitution being the supreme law, we have gone ahead to also enact a number of laws that reinforce our Constitution and provides for gender equality. Amongst this, that is related to our subject here, are laws around land and property rights. We also have a number of policies. We have the Land Policy of 2013 that reinforces the Land Act, both of 1998 and its amendment of 2004. We have the Domestic Violence Act of 2010, the Trafficking in Persons Act, and also we have the Local Government Act and a number of laws that provide for that. But I must say, of course, there are a number of gaps in the laws that we have in place. And also we have gaps in terms of implementation to ensure that they actually protect the rights of women as provided in the law. So you'll find that some of the gaps we have in law, for example, the Marriage Act and the Divorce Act, you'll not believe we still have the Marriage Act of 1906 that we inherited from the British. And we are in 2021. So you can imagine the type of laws we had then and the type of law we have now. I mean, the type of population that we have now, the situation that we have now, whether it is actually progressive enough. So we have gaps there. We have laws that affect women in terms of the succession. Although recently in 2011, we had the Succession Act amended, but of course, it was only the boy child or the male in the family who could inherit, and it was only a male who could bequeath wealth, and that already disadvantaged women. We also have other laws. For example, you find that laws around sexual offenses that are narrowly defined. For example, rape is very narrowly defined. It does not take into consideration the different ways and the emergence of abuse of women. For example, the online abuse of women using other objects other than the sexual organs of a man. All those are not considered to be rape or abuse, sexual abuse. We have limitations around women's bodily integrity in terms of how many children can I have, when can I have a child, the rights of abortion if need be. All these are limiting women's rights in terms of sexual and reproductive health rights. Now, the biggest challenge, I must say though, is yes, we have these laws, yes, we have gaps in them, but the biggest challenge that affect women more in terms of the inequalities and the burden around care work and gender-based violence is not the absence of the law, if I may say, or the absence of policies in Uganda, because I personally believe if we attempted to even implement the existing laws and policies, despite the limitations they have, we would be in a much better place. So what is the bigger challenge? The bigger challenge is the social and negative cultural norms that predominantly dominate our society. Because we would have no justification to still have the conditions that we have in terms of abuse of women's rights, even with the few laws and policies we have. Women in Uganda between the ages of 40, from about 49 and above, have experienced gender-based violence. Up to today, in terms of access to economic empowerment, access to productive resources, land, only 27% of women own land. We still have women who are dying due to maternal health and maternal complications, about 336 out of every 100,000 live births. The numbers of rape is increasing by the day, and for the last 1.5 years, close to 2 years now due to the pandemic, the numbers have grown so high that in the last 1 year, we have recorded over 5,000 young girls who have been defiled, and many of them are pregnant who have fallen out of school. These girls are as young as 10, 11, 12 years old. So one would ask themselves, is it the lack of laws? Is it the lack of policies? Or it is the attitudinal issues that we need to deal with, the patriarchal beliefs that subjects and subdues women to secondary human beings. So for me, I would like us to move from the presence of laws, especially in this part of the world, and policies, to really changing the mindset that women are equal human beings. The other issue that also compounds our challenge is the implementation. While it is important for us to have these laws and policies, implementation has been a challenge. And this challenge is, I could say, not only at a governance level, where you need the resources, both financial and human, but also the attitudinal issues. The same people who work in these institutions are part of our community. They come from our communities. So it's not going to be automatic because I work, for example, let's say in the justice and law order sector, that because you're there, your attitude towards women and girls would change. So there's a lot more work to be done in that area. And of course, we've had a big challenge in terms of the majority of our women and girls who work in the informal sector, but also are the least educated. They are the least in terms of getting, having access to information. So some of these issues have really compounded women's vulnerability in the informal sector during the COVID pandemic, and also the restrictions. I'm sure just like any other country, you've had a number of restrictions in terms of movements and lockdowns. And for us, we've even had a much difficult situation where we've had law enforcement officers who did not understand some of the directives given by government and went overboard in terms of beating women, girls being defiled and raped, and also that particular lockdown made it very difficult for women to access transport, to health facilities, to their workplaces. Many of these women who work in the informal sector, for example, in the marketplaces, some of them had to sleep in those markets for 3 weeks, for 1 month, for 6 weeks, leaving their children and sleeping in environment that is really, that exposes them to further abuse. Thank you. I know I had 2 questions. I don't know whether I should answer both of them.
I think actually we're going to turn now to audience questions because we're getting near the end of time, and I've got quite a few questions from the audience. So let's focus on what the audience wants to hear for the rest of our time today. Let's start with, and this is a question for everybody, and I'll invite my colleagues from ICRW Asia and Africa to come back online. Can we talk about some experiences, either through pilot programs or established programs that work to address imbalances in unpaid care and domestic work, particularly through technologies, ICTs? If anybody has a quick response to that, I would love to hear. Sharmishta or Nilanjana, can you start with that? Nilanjana, I think you're on mute.
Yeah, could you just repeat that question once more, Emily?
Yeah, absolutely. So I'd love to hear about experiences, either pilots or established programs that work to address imbalances in unpaid care and domestic work, particularly through technologies or ICTs.
So from my own experience of working with actually women's collectives and women community leaders who were trying to take a multidimensional approach to addressing some of the vulnerabilities. So during COVID, when one had to move to ICT platforms, etc., one of the ways was to actually organize certain kinds of key messaging through, mobile phones, etc., which would raise awareness, provide information about different kinds of available legal aids and everything. So one was providing information through ICT-enabled services. The second was to actually remain connected, and I'm talking about India, where not everybody has access to smartphones, etc. So even if there are ICT-enabled services, what the critical gap is that a lot of women actually do not have either access, or they do not have the kind of skill and the kind of learning that is required to use these platforms. So in that context, I think we should also think about, in situations of humanitarian crisis and lockdown and isolation, what are the other available forms through which women can access some sort of succor and some sort of solution when they are facing these kinds of gender-based violence situations. As far as unpaid care work is concerned, I think things like community kitchens, things like also messaging where husbands and wives, the whole family was asked to cooperate with each other to reduce the work burden on women in the household. Those kind of messaging help to an extent, but I think state-led services are much more critical here. So state-led services where states are or other civil society groups are organizing, care facilities or community kitchens. These are much more useful than any ICT-enabled services. I'll stop here.
Thank you, Nilanjana. Anything else to add from any of the other panelists today?
And I can just super briefly just build on what Nilanjana was saying. Yeah, that really plays out what we have found in Oxfam's research through the We Care program that Anam mentioned, in that when we do infrastructure or technology-enabled interventions such as water or other forms of technology, we find that it can reduce the amount of time that women are spending on care work, but it doesn't actually shift any of the norms around care work. So we found actually that some of these interventions were reducing the amount of time that women were spending on care work, but it was only with an intervention around social norms that men's care work and participation increased by up to an hour, and I'm happy to share the evaluation findings around that as well. But that's a really key finding for us.
Thank you. And unfortunately, I think we have time for just one more question, but is there any research about women in leadership positions and the GBV they might encounter in the workplace, so specifically women in leadership roles?
So I'm happy to jump in. There is actually very little research on gender-based violence and harassment in the world of work, period. We have some data about sexual harassment, but that is a much more narrow form of gender-based violence and harassment. So it's incomplete. And those studies are often conducted well-intentioned by people who externally come into workplaces. And so people are afraid. And so the data is really bad because people are just scared, right? To be honest. And so, that's one of the reasons we've taken the approach we have. So I am not aware of good data about women leaders and the specific forms of gender-based violence and harassment they experience or interventions. I am aware of some data about the specific experiences of women leaders with sexual harassment, but that's mostly in Western European countries and the United States. So its usefulness is a little limited, to be honest. But I think it's an excellent question.
Thank you, Robin. Is there anyone else who'd like to add to that at all?
Maybe I can share a little bit from Uganda. As an organization, we work with women in elective politics, members of parliament, and women at the local councils, which are in the sub-national level. And in 2016, after the elections, we conducted a research among women leaders to look at some of the issues that challenged them during the electoral process. And we found that many of these women said that sexual violence is one of the key issues for them in the electoral process, including those who are already elected. For example, in parliament, the sexual abuse is real and thriving. But most importantly, when we asked what are some of those factors that inhibit them, particularly in running for office, they said one of them is sexual violence. The other is the men would want to give you what they would call facilitate your campaigns, and that in favor then you offer sex. And the women said many of them could not talk about these issues because out here they are seen to be as creme de la creme, and they are seen to be as the stronger women of all the other women. So how do you start talking about sexual violence? So it is something that probably we need to talk a little bit more amongst the women, the elite women. I actually realized that women in the rural areas, the semi-illiterate or even the literate, are more open to talking about issues of sexual violence than the educated women and even women in very powerful offices. So some of these women in parliament could not even talk about the sexual abuses that they're going through because they are members of parliament, some of them are ministers, some of them serve on different commissions. So I think in the world of work, when we're talking about sexual violence, we need to probably target the high-end women or the educated women even more to open. Thank you.
Thank you so much. And thanks to everyone in the audience for these questions. We're going to try to keep answering them as best as we can in the chat, but unfortunately we're over time. So Thank you so much to our panelists and presenters today for joining us. Let me turn it over now to my colleague, Prerna Kumar, who's a technical specialist at the ICRW Asia office, to close us out.
Thank you, Emily, for such a great and very, very insightful session. Thanks to all our presenters as well as the panelists. I think my mind is buzzing right now with ideas, with all that has been discussed today. And it's very interesting to note that while we all agree that COVID-19 has exacerbated the very existing issues that women faced in the world of work, and the dichotomies that have been created, unfortunately, in defining work and defining the types of workers. It's also very interesting for me to see that there are several suggestions and solutions that we know have worked, and we know we can use them further. I think some of the key points that really stayed with me through this discussion is the fact that women not only lack access to decent work, but they lack access to even social protection. They lack access to opportunities for any kind of growth, irrespective of where they are in the workspace. Also, because of the fact that women carry the double burden of both unpaid care work, if they are part of the workforce, then it becomes all the more critical for us to urgently address the needs that they have. Unfortunately, none of the economies in this world really account for unpaid care work in their national accounting systems. The GDPs across economies do not account for unpaid care work, which women really bear the burden of across cultures and across countries. It's therefore, a few points that stayed with me is that there is an urgent need for us to bring in systemic changes, structural changes at all levels, whether it's the state, whether it's the market, it's the community, or even the household, and also at the individual level. How do we really do that? It's critical that families are provided support for some things as basic as getting access to water, clean water, getting access to fuel, and alongside that also accessing parental leave, accessing childcare, some of the very essentials that possibly could help families become more equitable. While we talk about women at work, we cannot really miss out on the fact that men need to be constantly engaged with if we really want to change the norms and really want to change the direction of the conversations and the discourse. It's also absolutely essential that we talk and address gender-based violence, whether it's in the household or at workplace, or even in transit, in public spaces, schools, and like one of the panelists shared, even within our parliaments. And it's therefore all the more important for us to ensure that women have the spaces and we create those spaces for women to be able to participate in not just defining the problems that they're facing, but also defining solutions that they want, in ensuring that they not only are being looked at as leaders in moments of crisis, but women's participation and women's leadership is supported through and through across workplaces and workspaces. It's equally essential, therefore, to support women's collectives in ensuring that we are able to bargain better. I am aware pretty much that we have gone way past the time. I'm not going to take longer, and let me just take this opportunity to thank Dr. Firoza Mehrotra. Thank you so much for being with us through this journey. It's been 45 years and you have been a great part of our journey. My ICRW colleagues who have presented, and a whole lot of us who have been behind the screen supporting this event. Also our colleagues from Oxfam and Uganda Women's Network, thank you so much for sharing your insights, sharing solutions, and sharing tools with us that we could all possibly use as we move along in changing women's spaces and the space of work for women. Let me also take this opportunity to thank all the women and girls, men, other stakeholders, our partners at the grassroots level, and government stakeholders for really participating and supporting us in discovering proof and disrupting power willingly. Thank you very much for today. Thank you for joining us and looking forward to this continued conversation. Bye.